So we've talked about difference between boys and girls, but sometimes either one of them have a hard time getting on. So there's some tricks that you can help with that. For the first thing is that I want you to wash your hands and I want you to put your pinky into the roof of the baby's mouth and feel how high that arch is. I have done this every time when I'm going into a room to help somebody or somebody's home. I put a glove on and I let them touch the roof of their mouth with my pinky, and I see exactly where it comes to. So if it's about right here, the tip of the pinky, then we're okay. We can usually handle just the nipple and probably not a shield, breast shield, or any extra support. You probably don't even have to hold your breast, kind of like in a ball. So if it's a little bit further down and you're like, I'm looking at my breast and they're inverted, there's no way this is going to happen, or they're not firm enough and you've hand expressed or you've used a manual pump and they just haven't come out yet, then you might need a shield. So then you're going to have to decide, I don't ever want to use a shield, I want to do this naturally, or I want my baby to try to latch on and get breast milk. So those are your decisions when you do that. So a shield will help pull that nipple out. It doesn't necessarily help with pain. Some people say it does, but for the most part, it really doesn't. If you've already got a blister, it's going to hurt, or if it's already red and raw, and it will be. Your breasts are going to be sore. Somebody is sucking on them every 2 to 3 hours. That hurts. You know, I mean, like if you were playing the guitar for the first time, your fingers would start hurting because you're learning how to play. They have to toughen up, and that's what those breasts have to do too. So lanolin cream and your mother's cream that you see, I think Amazon has a great few choices, but colostrum, like I said, is the best in my opinion because it came from you and it's what your baby is used to. So once they're off, you've rubbed someone that will help toughen them up. Also, when you are using the nipple shield, that might help, as well as they have something called nipple shells. Up there, I will put the link. Those are hard seashells on one side. Sometimes they have little holes, and then there's a cup on the inside, some round cover. So the inside has silicone, so it's soft. So I have moms that will put it over around. You can put it in your bra instead of using a pad, and it will help. And when you're breastfeeding, on one side you can put it on that side, and that will help. Or like I said, again, you can use the haka. Or any type of device that will kind of help that milk. But also the shell is to help so nothing touches them because they're so sensitive. You don't want anything to touch them, and you want them to kind of air out and let that colostrum instead of putting clothes back on. So you can put your maternity bra on and then slide those in there, and it allows them to air out. And if you drip in any colostrum, you can pull it out with a syringe. You can save it because of that little pocket in there, as well as it allows the colostrum to kind of heal to it. Nothing can get to it. So you'll know when you go to the grocery store, you'll feel your breasts are really sensitive with cold, or even with another baby crying, you'll feel and that you'll leak. And so if you have those in, it might just help so you can catch all that wonderful golden colostrum or breast milk that you have. But if a baby can't latch on, so that was the first thing I got off. But you would feel where that the latch is. And if it's high, then you need to do one or two things. Pull your the nipples out using the hand pump or your hand expression, and the second thing is you may need a shield. Also, this looking at their mouth, make sure there's no tongue tied or there's no problems, you know, and there might be. Your husband may tell you, or your mom may say, hey, you know, you had a tongue tie, so we had to get that snipped or whatever. So look and see if there's a difficulty latching. It may not just be you, it might be you and baby, and see if you might need that help. That would be definitely something you would talk to your nurse and your pediatricians about and see what would help in that situation. If you're having a really hard time and you're doing everything you can, you've gone to your lactation counselors at the hospital, or you've hired some, and they're looking at the baby and they're like, well, this might be, we might need it, and you're gonna have to, you know, decide if that's something that you need to do with breastfeeding. Now, I will tell you, this whole time I've been talking, I have not mentioned anything about a breast pump. Breast pumps are great for going back to work, and babies that are going to NIC and they're needing some breast milk, but they will not prolong your breastfeeding. They will actually hinder it. And the reason why I'm saying that is because, have you ever seen a baby eat like a breast pump? This is what they do. It sucks the whole time, either high or low, and it sucks the same time, the same consistency over and over again. And a baby does not do that. What they do is that they suck, and then they take the minute and they go prolong suck, and they're pulling it in, and they'll swallow. you'll hear that one over swallow. You don't want to hear smacking, because smacking is not a sippy cup. You don't want smacking. Smacking will lead to a blister. But you'll have a slow, long swallow. So that's what you want to hear. And with the hand pump, I have one, and I will show you about that in just 1 second. But it's got a quick release, and then a long release. And then you wait a minute, and the same thing is actually you're touching your breast. You're just like your baby was. You're kind of milking yourself. You'll see like cats and little puppy dogs, they will milk their mommies when they get their milk. So you're touching, you're connecting with that baby. That machine cannot connect with your baby. So if for some reason you have to go back to work, and I understand completely, and you've only got 10 minutes, well then by that time in 3 months, 6 months, you've established, you know, a good breastfeeding pattern, and you know when to breastfeed. And so doing that, there's nothing wrong with that, but just know I would probably watch a video or a picture of my baby, because you're still connected to that baby. You still need that feeling towards them. So if you are pulled away from that baby and you're not around them when you're breastfeeding, you're not seeing a picture of them or a video of them, then you may not get as much. So if you're having to go to the NICU, have somebody, you know, take a video of that baby and watch it, and then do hand pumping. You will get actually a lot more, because you're mimicking what a baby does. A machine does not do that. Machine is for quick service, and that's what it was made for, so we could go back to work, so we could be a mommy and a worker. You know, we have a job, and we have 2 jobs now. We have 3 jobs. We have a house to take care of, a husband or family members to work with, moms, you know, grandmas we have to help with, and we have newborn children, and then we have our job that we actually get paid to do. And so you have all of that you're trying to combine, and that is stressful. So for a new subject, we are going to talk now about the 3 reasons why your breasts dry up. Number 1, stress. You're already stressed. You just had a baby. Your body's physically and emotionally exhausted. Just thinking about going to the store and having to buy groceries is stressful to me. You got to park, you got to find where you're going to go, you got to make sure you got to hurry and get back in time to make sure you can breastfeed. That's exhausting. Use online, use Amazon, use, you know, your Prime videos, use your apps, your Target app, your Walmart apps. Use those to help minimize that stress. But also your body's physically stressed. It just went to deliver a baby. It's tired, it's overwhelmed. So use as much as you can, but this is something you really can't fix. You can't say, hey mom, stop stressing. That's just not in our blood. We just don't do that. So stress, we can't fix, honestly. We can minimize it, but we're not going to get rid of it. The second reason why our breasts dry up is dehydration. When you're breastfeeding, your baby's going to suck you dry. Your hair's going to fall out. Your nails are going to get brittle. You could probably put baby lotion or oil on your legs, and because you're all ashy and dry and stuff, and you look down and you're like, oh my gosh, I'm still dry. What is going on? And you're taking your vitamins, you're doing everything else, but you're forgetting to drink water. Water, water, water. 1 breast, 1 bottle of water. You have to have water. If somebody's taking fluid from you, you have to be hydrated. So usually at the 2-week mark, moms will call or let me know, go, hey, I'm not producing enough. What's going on? Well, once again, the miracle of birth, you have all this extra volume when you delivered, and your nose is swollen, your ears, your labia is swollen, your legs are huge, your hands are swollen. It's like God gives you enough reserve of your body to carry over for 2 weeks. So usually we have enough good reserve, but after 2 weeks and you're not really drinking your water because you're exhausted, you're not thinking about I have to be hydrated, and all of that extra fluid has come off, then the baby's going to start getting less because you're producing less. So you have to drink water. So wherever you're going to sit to breastfeed, and I don't recommend breastfeed in the bed. It's hard. You're bent over. You may have a repair, an incision that hurts, and you're trying to move the baby, and you got to get your shield, and then you got to get your bobby or your lullaby pillow or your my breast pillow, whatever you're using. And it's hard to position just right, and then you got to get everything situated and the baby, and then you'll have to move them back and forth. So I do recommend like a tall chair or recliner, something that's good support and have everything around. And the most important thing is to have, other than all your equipment for your baby, like, you know, your diapers and stuff you can change and do everything in that one area, have like a case of water or your water jug right there to help you. So just remember, 1 breast, 1 pitcher of water. And I will tell you another little trick is when they first latch on, it's really, really sensitive, and it's owie, 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 but it's only an owie for about 30 seconds. Even if they've got a perfect latch, it sometimes stings just for 30 seconds because they get so excited, go quick, quick, quick. Remember that quick, 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 and then they go slow, and then it calms down. So in that sense, what I tell moms to do, this is not if you've had a C-section because you don't want to add any more air to your tummy by drinking through a straw, but put a straw through that cup or that bottle that you're drinking. And when the baby's latched on and it's uncomfortable, you grab that bottle and you suck, 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 suck. By the time that water's done, or you taking a breath, that latch is not so bad, and you drank your water and you forgot what he was really doing or she was really doing hurting you, and you mentally able to get through that next hump. So that is a simple trick just to let you know, using a straw to drink your water as fast as you can. So number 2 was water, dehydration. So the third reason why your breasts dry up is, again, that breast pump, not a handheld pump or a hand expression, a breast pump. It's a machine, and your baby is not a machine. You have to mimic what a baby does. So if worst case scenario, you're at work and you are not what they call a milk cow and it's just not pouring out for you, and you don't have anything saved, and you're really trying to make sure you can extend it, and you already know you're physically stressed, and you know you're not really drinking enough water at home or at the job, then bring that hand pump and watch a video of your baby. You can do that machine pump, but just one breast side, kind of massage it, try to push that out, and watch a video. That is to try to continue to help with using the machine. Once you've established, then you're doing great. So those are my 3 reasons why your breasts dry up and how to help you prevent that. Thanks, y'all, and y'all have a great day.